This program is designed to provide general information with regards to the subject matters covered. This information is given with the understanding that neither the hosts, guests, sponsors, or station are engaged in rendering any specific and personal, medical, financial, legal, counseling, professional service, or any advice. You should seek the services of competent professionals before applying or trying any suggested ideas. The information contained in this podcast is intended for informational purposes only and is not a substitute for individual professional legal advice. The podcast information was carefully compiled from vetted sources and references. However, R.O.S.E Resources Outreach to Safeguard the Elderly cannot guarantee that you will not fall victim to a scam. Let's talk about scams. It's the must-listen show for anyone who wants to protect themselves and their loved ones from scams. Every Tuesday at 8 a.m. Pacific Time on K4HD Radio, Joyce Petrowski, founder of R.O.S E, and her guests will provide valuable insights and practical tips on how to recognize and protect yourself from scams. And now, here is your host, Joyce Petrowski.
Hi, I'm David.
Staying active mentally, playing chess, those are all very important things.
I'm 72, but I'm going to keep on learning. I'm going to keep on moving. I'm going to keep on living my life.
Healthcare for David's next move. Learn more at archwellhealth.com.
Welcome back, everybody. I'm Joyce Petrowski, founder and board president of R.O.S.E Resources Outreach to Safeguard the Elderly. You can find more information on our website at roseadvocacy.org. Our social media links are at the top of the homepage. Scroll down to the bottom and you'll find where you can sign up for our emailed and or our mailed newsletter. The emailed one every Tuesday morning at 9:15, you're going to get a Tuesday tip with information you might not know, or it could be some information you already know. But an added benefit is that it's going to help reinforce your scam prevention habits. As you know, to make anything a habit, we need to hear it, read it, see it, say it, all that multiple times to make it a habit, and then continue to see it to continue the scam prevention habits in your healthy skepticism. Today, we're going to talk to Mary Doyle from Adultcare Assistance Homecare on non-medical home health care. So let's welcome Mary.
Good morning.
Hey, Mary, how are you?
Doing well, thank you.
Good. Tell us a little bit about you and Adultcare Assistance Home Care.
Perfect. Well, first of all, thank you so much for having me this morning. My name is Mary, and I am with Adultcare Assistance Home Care. A little bit about me personally. Grew up in the Midwest. I moved out here to the Arizona area about 5 years ago. I am a sunshine girl, so the heat, the sun, the hotter, the better. So I've always said I was born for Arizona, and I finally made it here. So love it. I'm an outdoors person. Married, 4 kiddos, couple pups. I just enjoy life.
Good. All right. Well, I was trying to think back to when I first met you. It's probably been 2 or 3 years ago now. Probably 3 or 4 years ago now at one of the networking events, I think.
Yeah. It's been at least probably 3, but probably closer to the 4-year mark. Yes.
Yeah. So, all right. Adultcare Assistance Home Care. You guys are non-medical home health care. So explain what non-medical home health care is.
Yeah. So a lot of times when people hear home care, they normally, even doctors, physicians, nurses, they still get it confused with home health as well. So we really want to highlight the difference between the non-medical home care and home health. So when people hear that, they often think of nurses and physical therapists, but non-medical is different. We're there to help people remain independent and safe in the place that they want to be most, which is their own home.
Right. So, and you guys are, I know you're in the West Valley, but you also in Tucson.
We are,
and you've Scottsdale, and you've just recently opened in the East Valley.
Yes, so we are serving most of the valley now. We are in the West Valley, the East Valley, up north into Scottsdale, and we do have a location in Tucson as well, serving now the Green Valley area. So we're continuing to expand. We keep identifying the needs, so we are trying to go and work where the need is.
Awesome, awesome. So, do do insurance companies, like insurance companies would normally cover like medical care, do they cover non-medical?
They do not. One, because it's not health care that's needed. It's just that non-medical that's needed, the assistance to remain independently or recovering. But we are contracted, so a lot of our services are private pay, but we are contracted with the VA. A lot
Okay,
of veterans are not aware that there's this benefit that the VA will cover for them. So the VA covers a slight portion of services. Private long-term care insurance also will subsidize a lot of times. They'll reimburse for our services.
okay,
Um, there is with Medicare, there is it's called the Guide program. And so they're allotting just a very short amount of hours per year. Until that program gets funded, it's kind of limited on what is offered through
okay.
Medicare. And then a lot of times people don't realize that your life insurance policies, a lot of times there's a living rider benefit in that that
Oh,
people can tap into. So we're trying to educate on that as well, that you don't have to wait till you pass to have some of these services or to utilize those funds that you've been paying into. So you can, depending on how your policies are written, you might be able to utilize some of that to recover or to have the assistance in your home.
well, that's interesting. So, is that something where somebody would need to go to their life insurance company to find out if it's covered, or do you guys help them navigate that?
We definitely will help navigate. A lot of times, if they have a copy of their policy, we ask to review it with them, and we can most of the time identify whether or not they have those benefits listed. But we'll help navigate the systems, whether it's the VA system, long-term care insurance, or that life insurance policies, the annuities. We will help walk them through that process.
Wow, that's great. Instead of saying, "Well, talk to your insurance company and come back if you have the benefits," right?
Yeah.
Um,
And a lot of times we'll have to, once we identify if they have it, we will sit with them while they make the phone calls because, they're the ones with the policy. So a lot of
right,
times they won't talk to us, but
right,
we can sit with the prospect and ask them,
right. Okay. So somebody finds you, whether it's through a referral or they find you on the internet or the doctor, you're one of the referrals they hand out and they call you. What are the first steps?
yeah, the first step is the phone call. So just call and find out. We want to explore. We're trying to identify the true need when they're making that phone call. So it's just going to be a conversation with us. You're not obligated at any time to sign on to services with us. If you're just looking for education, looking for resources, looking for advice, what those next steps would be. We will walk you through it. So we're going to have that conversation, listen to what they're saying. We're going to help identify needs. A lot of times, what they're calling for, they don't realize that there's more that goes to it. Um,
Okay.
the big thing I like to say is a lot of times we might get a phone call and they're like, I just need help with a shower. And I'm like, shower really is a basic task every day. And if we're having issues taking just a shower, what else are we having trouble with? If they can't shower, they can't bathe, can they do that housekeeping? Can they get out and run those errands? Everything kind of goes hand in hand.
And you guys will help with all that. I mean, you'll help with some housekeeping, running
Absolutely.
errands.
Yep, yep. All of our services, we're there to help you remain independent. That's the thing. People start to fear that once they bring in home care that they're going to lose their independence.
Uh,
But our job really is to keep that independence without being alone. We can come in, we'll assist with your ADLs, your activities of daily living, and that can be from bathing, dressing, grooming, help with meal preparation. Maybe they're doing frozen meals because they don't have the energy to prepare meals, or they can't go get the ingredients, so they're just doing the quick fix. So we can prepare healthy, balanced meals. We'll do the light housekeeping, their laundry. A lot of things the elderlies will wait to change their bed linens because it's so hard. I even struggle sometimes
Yes.
getting the sheets on my bed, right?
The final corner, trying to get it
Yes,
on the mattress.
that one corner. And so those are the little things, the things that we take for granted and we start to just kind of put off. So we let them know, hey, we can come in and do that. We'll do your laundry. We'll change your bed sheets once a week. Medication reminders. This is huge. Making sure that they're taking their medications as prescribed. We can't administer medications, but we can do the reminders. So we're going to be reporting on whether or not those meds were missed. We come in and we see that we hadn't been in there for 2 days and they didn't take their medications for 2 days. Now they're more confused, or they're having an off day. Well, that's a big indicator as to why. So we'll start with that. Transportation to appointments. Again, just getting them safely. Yes, there's Uber. Yes, there's other ways to get to your appointments, but they'll pull up and you have to be ready, and you have to get out to the door, into the car. They'll drop you at the curb at the doctor's office. We do not do that. We will allow time. We'll pick you up, allow you time. Maybe we help you take a shower before we go to that appointment. We'll get you in the car. We'll transport you there, get you in safely, and we wait. Sometimes we have family members, the responsible parties, that are out of state. So they would like someone to go with their loved one to that appointment and take notes and be that reporter back to them.
Oh, that's a good idea.
Yeah, because sometimes, they forget what the doctor said, or the language that the doctors are using,
It's confusing.
confusing. So we go in and we can take notes and be those reporters, or we could even bring them in on a video call and they can be present with the appointment.
Oh, that's nice.
Grocery shopping, errands, companionship. I think that's one of the big things that's overlooked a lot of the times, is, people kind of downplay when you talk about the companionship, but loneliness sinks in after a while, and
And
that can be
that's
just
huge.
as damaging. Yeah.
Yeah, the loneliness can start the trickle down effect of a lot of other issues. You mentioned, oh no, I wanted to ask you, do you guys require a minimum amount of hours a week?
No. Obviously, the more hours you have, the better. One, for consistency, right? We used to have a minimum, but we were identifying that there were clients that just couldn't afford it, or they felt they didn't need it. Now, being in the industry, we understand that, they say, I just need help with a shower or a load of laundry. But really, to get the quality of care and the true assistance needed, we don't like to be rushed. So the longer we did have a 4-hour minimum. That was to be able to get in there. When you start to build that relationship, if you're just in and out and that's task based, you really don't build that rapport, and then you start to feel rushed. And like anything, if anybody's starting to feel rushed, you risk, having accidents or
Right.
issues. So we definitely don't want to push them to hurry them through what we're there for. So we do have what we call a service call. The service call is anything up to 2 hours. That's a flat rate. So maybe they do just want a ride to the doctor's office, or
Okay.
they only want a shower. That's fine. We can come in and do that. But the continuity of care is just not there, because you're not guaranteed the same caregiver on those short shifts.
Got it.
And it's going to be based off of, the caregiver's availabilities. If you do at least a 4-hour shift, we can then be more consistent. Caregivers are more apt to pick up those longer shifts. They don't call out as often. So if you schedule them to a 2-hour shift, they, sometimes our caregivers work for different agencies, right? Because on home care, 8 hours aren't guaranteed. The hours aren't there with the client. We can't offer those out. But so a lot of times our caregivers work for different agencies. So we found that that 4 hour minimum is kind of the sweet spot where they're committed to that shift. Otherwise, you have them on a 2 hour shift or anything less than the 4 hours, their other agency calls and says, hey, I have a 4 hour or 6 hour. They will do last minute call outs with the shorter shift. So that's a few of the reasons that we try to stick to that 4 hour mark, so you can get consistency, the same caregiver, and it's a little bit cheaper. The service call rate is a flat rate. It's a little bit more because we have to incentivize our caregivers to accept those shorter shifts.
Right.
So, yeah.
Yeah, and I would think, you're having somebody that you don't know come into your home, right? That you'd want to be able to establish the rapport, the relationship with them, and have the same person be the one coming in and caring, because then they get to know you, right? And how you like things done and all of that. And so then you kind of, and I guess you probably have run into this where maybe the personalities between the caregiver and the patient don't necessarily mesh, and so you try somebody else, right? Not
Exactly.
every two people, their personalities mesh. So
Correct. Yeah, and we
yeah.
do our best. We do try to pair caregivers based off of those different traits and attributes. But I always tell our clients, give us the first 2 weeks, right? We don't always get it right the first time. Majority of the time, we are able to do a pretty good match. But please call if you feel like it's not working out or there's something going on. We've got multiple caregivers, right? So just because it's the one that we sent you, that doesn't mean it's the only one we have. We can definitely work it out and find somebody that's a good fit. But you can't really establish that in just a quick 2 hour visit. So
Can you hear me, Mary?
yes.
I can't hear you. And I'm trying to, I just went and switched my settings back to what they should be. And for some reason, it's not working. Hang on a second.
Okay.
All right. Try it again.
Can you hear me?
Nope. Uh-oh, this is where I might try refreshing the page. Thank you, Juan. All right, let's try it again.
Good morning.
All right, I can hear you now. I don't know what happened,
Okay.
but it was you were talking, so I didn't hear anything you said that last time around.
Okay, yeah, I was talking about how we match our caregivers and their clients based off attributes, skill.
Oh, okay.
So based off of their skill need and our care, or the level of care needed and the skills of our caregiver, we match that. So most important is that safety supervision, making sure that we can take care of the need that is there. But personality is huge. If the client, we're going into their home.
Right.
So we want to make them feel as comfortable as possible with who we're sending in there. So we always tell our clients at any time, if you feel like this is not the right fit, please advocate for yourself. They can reach out to us. Just because it's the caregiver that we sent in, that doesn't mean it's the only caregiver we have. So
True.
we've got lots of caregivers, and we really try to stress the care team. We don't want just one client with one caregiver either. In the
Okay.
event life happens, caregivers call out, family emergencies, we like to have a care team. So we try to introduce at least 2 caregivers to every client so they know who might be the fill-in when their regular calls out.
Got it. Okay. So I've heard a lot of people in the non-medical home health care field talk about how this type of industry is not regulated in Arizona.
Correct.
So, but there is another agency, Arizona In-Home Care Association, that you can belong to, which I believe you guys do belong to it, because I think I a while ago looked on their members list and I saw you there. That holds their members to a higher standard. Can you explain a little bit about that, especially with it being non-regulated?
Yeah. Yes. So in Arizona, it is not regulated. There's no oversight to home care, which is scary. We call it the Wild West out here, which means anybody can open up a home care agency. They don't have to meet their caregivers. They can do 1099 employees. It's crazy. So with that, Crystal Wilkinson, she's the owner of Adult Care Assistance Home Care, and she is part of OSNAHA, the Arizona In Home
Mhm.
Care Association, as well as the HCAOA, which is the Home Care Association of America.
Oh,
Crystal is
okay.
actually the president of the Arizona chapter for that. Advocating and trying to push for regulations here in Arizona to protect our seniors. That's the big thing, is because it's really leaving our vulnerable population at risk
Right,
without
right.
those. So when choosing a home care agency, that's probably the first thing you want to do, is just educate yourself. Is this agency part of OSNAHA or part of the Home Care Association of America? Are they holding themselves to higher standards? Because nobody's watching us, nobody's checking in, nobody's doing that for you. So if you hire a company that's a 1099, they're hiring their employees at a 1099, not W2. So they're not taking any risks or liabilities on your behalf if they do not have W2 employees. So that's basically, you're hiring a private caregiver. If something happens within your home, you're fully responsible. So a lot of times they're like, oh, I'm just going to use my friend from church because
Right.
it's cheaper, or I'm going to use this agency because they're cheaper. Well, is it cheaper because they're not paying all of those taxes and liabilities and insurances that are actually going to protect you in the end?
Right.
So that alone is the biggest question. And we help people when they're calling around. I always tell them, we may not be the one you choose, and that's okay. There are multiple agencies that do a great job. But if you're going to shop or research, please go to that osnaha.org website, and any home care agency that's listed on there, I would highly, I would say they would be okay to go with, because they are the ones that are being held to those higher standards. We have to make sure our caregivers are background checked. We do, state and federal background checks on them. They have to have a fingerprint clearance card, TB. They have to be CPR first aid certified. Driving records, we pull 5 years prior to employment. I mean, because a lot of our clients need that transportation assistance. So
Yeah.
we need to make sure that they're in somebody that's safe to be with. And then drug testing. We drug test at time of employment, at hire, and then randomly throughout. We get some pushback, we even say yes for marijuana. We're going to test for that. And it's legal. It is, but you still can't be under the influence. So we are 100% drug free. Our caregivers are 100% drug free, because again, we are putting our clients at risk at any time that
Right.
somebody falls outside these guidelines.
Right. And I think you hit the nail on the head. A lot of people don't think about, um, like you said, hiring a friend of theirs from church, or their neighbor says, "Oh, I had this person help me. It was just for a couple weeks or a month or 6 weeks while I rehabbed, and it was so great." And they're a lot less expensive, and um, but you don't realize that there are so many different things that can happen, especially if you need them, possibly need them around the clock, where you've invited them in and they're now living in one of your extra rooms, for 4 or 6 weeks while you rehab. You get to the point then where you're done, and you don't need their services. Well, sometimes people have had to go through the eviction process to get them out, because right?
Oh,
Or, even if they're not living with you, but they're at your place, helping you, and they slip and fall.
yep.
Well, now you could be held responsible for all of their medical costs. Um, yeah, there's just,
Yeah, there's
so
so
many
much that
different
goes
ways
into
it
that.
can go wrong.
Yeah. And
Yeah,
that, I think, is, like I said, the biggest thing. If I could educate on anything, I think it would be hiring privately versus a vetted home care agency.
yeah. Yeah, definitely. It might cost you a little bit more out of pocket, but the benefits that you're getting far outweigh that. Just the peace of mind knowing, right, that if my caregiver got sick or got into an accident or their kid got sick or something, that there's going to be a backup. I'm
Right.
not going to go without. And if they happen to get hurt at my home, um, then I have peace of mind knowing, right, barring any negligence and stuff like that. But I have peace of mind knowing that the agency is going to cover that based on their insurance and all of that.
Yeah. And I think too, the biggest thing is those boundaries that get crossed. When there's no oversight and you've got somebody just coming and going, um, we've seen it so many times. And a lot of times we get called in because the caregiver has now, there's a lawsuit against this caregiver, or there's been something that's happened. They've started this, they were stealing from the clients, or um, families are getting involved because they feel like they're getting their loved ones getting taken advantage of.
Mhm.
So just having oversight from an agency, a vetted agency, there's no comparison to that.
Yeah, yeah, and I wasn't aware of the Healthcare Association of America, and that's awesome that Crystal, you said she's currently the president for the
Of the
Arizona
Arizona.
chapter? Wow,
Mhm.
that's awesome, and actually on a side note, I think, Brian Watson, our community outreach specialist that's in, Tucson, is gonna be doing a panel with a few other people with Crystal.
I just seen Brian not a couple weeks ago. He was on we did a presentation
Oh,
over at
was it a couple weeks ago that he did it with you guys?
yeah, yeah.
Okay.
So
I
yeah,
I was going back and updating the schedule, and I'm like, "Crystal Wilkinson, why do I know that name?" And then I
yeah,
looked more into it, and I'm like, "Oh, that's where Mary works."
yes, yeah. So I went down to Tucson. I think it was about 2 weeks ago, and Brian was there, and he presented on R.O.S.E. Did an amazing job.
Oh, good.
So
Good,
yeah,
good.
like
But, yeah, so, obviously, the show is called Let's Talk About Scams, but, you know, I think a lot of times we talk about online scams and, people you don't know, where it's more of exploitation, right? When it's people you do know. But it does happen
oh yeah,
and it has happened here in the Phoenix area where people have recently, lost their spouse, and then somebody befriends them, and gets them to allow them to move in to help take care of them. And it just snowballs after that, right? Then
yeah.
assets are turned over into the caregiver's name and all that stuff. And it can just, and then you're at a point where it's like, what's my recourse?
Mm-hmm.
Right. So
Yeah.
that having that association like OSNAHA, which for people that aren't familiar, it's Arizona In-Home Care Association, but the website is AZN as in Nancy HA.org, right?
Correct.
Yeah.
Mhm.
And you can go in there and you can look at a list of you can look at a directory. And if I remember right, it says a little bit about each company and what type of, like, if you're accredited with the VA, they'll put that in there as well. Um,
Yeah.
um,
Yeah. And it's nice because, like I said, we serve most of the valley here, but sometimes I get calls for areas outside of where we're at.
True,
Um,
right.
I can go to osnaha.org. I can put in their zip code or an address and say, home cares near here. And it will give me a list of home cares within that area for them that I can say, I've personally never used them. It's out of our area, but this is who osnaha.org would recommend. Again, if I can pull a name off of that website, I feel good about saying give them a call.
Yeah. And you can even pull a few of them off of there, right?
Yeah.
If you want to interview two of them or three of them or five of them, whatever makes you feel comfortable.
Yes.
Yeah.
Yeah.
Um, Is there anything else that you have come across or heard about when it's in-home care? Um, well, how about like if somebody's interviewing a company, like are there specific questions that are really good that they should be asking these companies?
Absolutely. Again, I think the biggest one, it's we don't know what we don't know. So when you're calling around, again, a lot of people get hung up on the cost. put costs to the side. I don't feel like you can really put a price on your health. You're going to get a range of pricing, and just think of it, if you're going on a vacation and you want to pay for the best hotel, you're going to have to pay a little bit more, right?
Right.
So sometimes you are going to get what you pay for. So please don't get hung up on the pricing. But when you're calling around, please do your research. I highly encourage that. The first thing you want to ask, again, to protect yourself, is, are your employees 1099 or W-2?
Okay.
That's the biggest question you want to ask, because then you know whether or not you're going to be solely responsible for risks and liabilities, or is the agency that you're hiring going to take on that?
Right. And if they're W-2, then that means they're employed by the agency, and the agency is going to assume the risk.
Correct.
Okay.
Yes. So those, and are there long-term contracts? Some agencies, it's in the fine print that, you're signing this contract and you need to give us at least 2 weeks to a month to discontinue services. That's not always feasible. So just find out really what is entailed in the documents that you're signing. Am I obligated? Do I need to pay up front for services? A few agencies do require a deposit up front. We do not. We come in, we do that initial assessment at no charge to you. And then based off of what your needs are and what our professional opinion is from our care manager, we come up with a game plan. And then you pay for services that you utilize after the fact. So we'll invoice you for your services every 2 weeks, and there's no upfront cost to get started.
Okay. You mentioned you guys do an in-home assessment free of charge. You go into that a little bit more.
Yeah. So when we get that initial phone call, we're exploring, from that phone call, what they feel their need is. But a lot of times, some people are not true reporters, right? They're going to explain their best day when really that's not been their best day for a long time. A lot of times people wait till a crisis happens to call us. So we
Right.
say, get ahead of it. Don't wait till that crisis happens. Once you start seeing the signs of forgetting medications, missing their meals, falls, or fear of falling even, difficulty with keeping up the house, maybe a loved one's been taking care of them and they're just getting that burnout, isolation, again, the companionship piece that I was talking about,
Right.
memory changes, or they're no longer safe to drive, right? They don't want to give up their driving, but we can see that it's no longer safe. That's when we need to start having these conversations and having the phone call come in. But from that initial phone call, it's exploratory. We're going to be asking a lot of questions, trying to get some background on it. And then our next step would be, thank you so much for sharing this with me. I would love to have my care manager come out and meet with you, do a quick in-home assessment. Again, it's a chance to get eyes on the client, on what's truly happening, eyes on the home. Sometimes, we don't feel comfortable sending a caregiver into a home that we've not been into. So we want to
Oh.
for sure make sure it's safe. Is it a hoarding situation, or, are there holes in the floor? Is it running water? Is it even safe for our senior to be there before we send a caregiver in there? So that's huge. If you're getting people that are doing online assessments or over the phone assessments and not even stepping foot into your home, that's of a concern, because you don't know what you're sending somebody else into.
Right.
So we schedule that appointment, again, free of charge to you. We come in, it's usually about an hour. Could be an hour and a half. Each case is different depending on what we're going into. But we're going to not just talk about your needs, but we're going to do like a physical assessment as well. You say you walk just fine. Okay, show me. Oh, I see you have a walker. Let's see how you get up and down with that walker. You need help with a shower. Why do you need help with a shower? Is the bath cluttered? Is there not room to move around in the bath? Do you have the proper DME in place? Do you need a shower bench? Do you have the handheld shower head? So we're going in
Right.
and we're assessing not just them, but the home, to set them up for best services and how can we serve them best in their
Right.
home. Yeah.
Right. And especially, for people that their family is out of town, out of state. And
Right.
so they're not there. They can't come every weekend, right? And check things out. Having that professional set of eyes that is actually evaluating and knows the questions to ask, knows what to look for, knows what should be there but it's not there,
Right.
that can
And
help, is just I think that all of that brings so much peace of mind.
yeah. Yeah. And again, we're in the industry, right? We see this every day. This is what we live and breathe. And those that are calling us, they're in the moment. They're in the crisis. They don't know where to go the next steps. And so if nothing else, it's a phone call and it's resources. My background is social work, so I'm all about resources. I want to make sure everybody gets all the answers and solutions that they possibly could need, whether that's our services or other services. I have a huge list of resources that I refer to all the time because I'm looking at each client holistically, not just, oh, they called me because they feel like they need my service. At the end of the day, if they need my service, I am sure there's other services that can benefit them
Right.
and have that continuity of care across the board.
Right, yeah. Because you mentioned it earlier, you don't know what you don't know,
Yeah.
right?
It-
And the other thing was the whole, a lot of people do have life insurance policies,
yeah.
but we think about when we think about life insurance, we think about it as it's going to be there to take care of the expenses when I pass, so I'm not going to burden my family with that. But you can tap, depending on how it's written and what kind of policy it is, you can tap into that ahead of time to help pay
Yes.
for care.
Yeah, and
Um,
that's something that a lot of people don't realize. And so we're really trying to educate them now on that. Like, you don't have to wait till you pass to have those benefits. Use it now. This is something you've been paying into. Use it for when you need it. So as long as your policy has it, we encourage you to use it.
right. And then you mentioned Medicare has a new
It's
policy.
yeah, it's called the Guide Program. Through Medicare. And again, it's very limited on the hours that they allot per individual, but they're starting to see the need. So that's exciting because previously, home care, Medicare turned their head to, right? It
Well,
was
it was
like a,
always after the fact, right?
yep,
They would pay once you got hurt and went into the hospital or went into rehab or whatever, and it's
yep,
always reactive. So I'm
correct.
glad to hear that the government, part of the government, is actually seeing the need for, if we can just help people be proactive about things where they can stay in their home safely for a longer period of time, we're going to save so much more money than having
Oh,
to
yeah.
pay for hospital stays, surgeries, all this other stuff.
Yeah, and I've always said that be proactive, not reactive. I see
Absolutely.
home care as the preventative piece. You get services in there before that crisis happens. You're going to have less hospitalizations, less rehab visits, less falls, right? It doesn't guarantee that you're not going to fall, but get us in there early. We start seeing the signs and we can start getting resources in there and prevent a lot of what happens next.
Instead of waiting for something to happen and then
Yep.
go, oh my gosh, right? It's kind of the same thing with what we do, right? A lot of people are like, they don't say it, but they're thinking it. Oh, my loved one will never fall victim to a scam, or I'll never, fall into a scam. And it's like,
Hmm.
well, if your credit card's been compromised, you in essence have, whether anyways, it's, I could go on and on about that,
Yep.
but it's being proactive and going, why do you want to wait to see if it happens, to clean up the mess and then
Right.
all the added costs on top of it,
Yeah.
right?
I always say you're just one fall away from major life changes. So get us in there early, be proactive, let us prevent some of
Yeah,
the things that could happen.
right.
So,
And you mentioned another thing was that a lot of people wait until they have the need for it. And usually, when the need arises, it's a panic situation because you need to have it right away. And so, if you can, call you guys, talk to you about what you do, if any of your insurances would fall under that, the VA, whatever, get your price, and and then, look at Osnaha and look for a few other ones, or if they're not in the service area of where you guys work, they can put in the service area, find out places that are in those areas, interview them,
Yeah.
gather the information, and okay, maybe you need to make a phone call once a year just to update. Have your prices increased? Have you changed anything? Right. Um, but so when the need arises, you're not going to panic. Because as
Right.
I tell people, and we talk about this a lot when it comes to a tech support person, nobody wants to have a tech support person in their back pocket. They wait until the need arises, and it's usually a panic situation. They Google and take the first person they find, which could
Yep.
be somebody who's not reputable, not legitimate, could be a full on scammer, right?
Sure.
And could cause a lot of devastation. So especially with Arizona not regulating non-medical home health care companies, they could Google and find some company that's not very reputable, or that maybe is quote unquote scamming people, right?
Yeah.
Because they're in a panic situation. Panic is emotion.
Yes. Yeah,
Yeah.
I 100%. I always say get ahead of the game. Um, do your research, get things in place before you need it. I do a
Yeah.
lot of different vendor fairs, and people will walk by and I don't need it, not ready for that yet.
Yeah.
I'm like, you're not, but you never know when you might be. So having the information ahead of time, we'll do that in home assessment. We'll do everything and have you on standby. Just because
Yeah.
we come to do it doesn't mean you have to sign services, but you're ready. You're ready when that time comes.
Right.
So always get ahead of the game.
Yeah. I mean, I didn't think I was going to need a home health care agency at 54, 7 years ago. But I did. I didn't anticipate breaking my knee and dislocating my elbow all on my right side and having to be in a wheelchair. And
Yeah.
my husband had to work and I had nobody else to take care of me. So I had to hire a home health care agency.
Yeah.
Luckily my sister worked in the senior industry. And so she had some companies that she had worked with that she referred me to, or she actually did the legwork and got it all worked out. But not everybody has those resources. Not everybody has a family member that's around that works in the industry that would have these resources. So
Yeah.
yeah, it's really good. Yeah, as same with you, Mary. I can't say enough about being proactive.
Yeah.
It just is peace of mind. So any other things you want to say about non-medical home health care, about adult care, assistance
Yeah.
home care?
Well, I think another point that I wanted to touch on was um, a lot of times people overlook this too is the family caregiver, right? You've got somebody that's providing the care for you.
Oh, okay.
They get burnt out, right?
Yes.
So use us as that respite piece. Let's give your loved one a break as well. A lot of times they're trying to balance their life. They've got careers, they're raising kids, and now they're also trying to care for a loved one. So asking for help isn't giving up. It's making sure that your loved one receives the best care possible while
Right.
also protecting their health. Because burnout is a real thing. So
Well, yeah, if
peace
your
of mind.
caregiver gets burnt out, it's not good for their health, but then they can't give you the best care that you need if they're
Right.
burnt out.
Yep. So always tap into that too. Be the wife, be the daughter, and let somebody else do the care and take care of your loved one, so you can, you know, keep that relationship
Yeah,
with your loved one the way it should be.
right. And the VA has a respite care
Yes.
program, and I don't know about other insurance companies. You'd have to check with your insurance company or go over your policy with Mary or someone in her office and
Yes.
find
Yes.
out what all is available.
Yeah, we would love to help walk through any of these and navigate that system for you and find out where we could benefit you.
Yeah,
And use the services that you've been paying for, right?
absolutely.
You pay into it, use it. I
Use
tell
it.
our seniors a lot
Absolutely.
of the time, you know, you've served, you've given so much of your time. Now let us take care of you. Let
Right.
us come in and help
Absolutely.
you.
Yeah.
Yeah.
And I think through the VA, that respite care is available. Um, I mean, I don't know all the ins and outs of qualifying for, there's so many different programs, but again, you guys know all of
Yes.
that stuff. If you're a veteran
Yes.
or if you're a spouse
Yes.
of a
A veteran
veteran,
or a spouse of a veteran, please reach out to us. I would love to educate you on what services there are out there to help you, especially with home care. Again, they don't need to have nursing services. They don't need a licensed nurse or PT, anything like. There are home care services to help keep your loved one in
yeah.
their home.
And do you guys help complete the forms with them? Do you guys, okay.
Yeah.
Because I know
Yep.
that's a big thing with one in particular. I've heard is like a 20 or 30 page, well, I don't know about the form itself, but all the stuff you have to send in with it, it becomes cumbersome.
It is a process, and our care managers do an amazing job. They'll walk you through step by step from the beginning, from not only just submitting your request, but getting your appointment with your primary care doctor to getting that appointment scheduled. There's so many steps to the process, but our care managers have it down to a T, and they can
Good.
pretty much
Good.
expedite a lot of the things.
Good. All right. Wow. That's a lot of information, but it's a lot of valuable information. I'm so happy that you're available, Mary, because I think there's a lot that people don't know about non-medical home health care.
Yes. Yeah, I agree. You know, I've seen firsthand that the right caregiver, having somebody in place, can change the entire family's life. So
Yeah.
it's not just about helping somebody bathe or prepare a meal. It's about giving families and, that peace of mind and allowing people to continue living with dignity
Right.
in their home that
In
they
their
love.
home. Right,
Yeah.
which is where everybody wants to stay, is in their home as long as possible.
Yeah.
Yeah. So, all right. Thanks again, Mary. I really appreciate all your knowledge and expertise on
Yeah.
this.
Well, thank you so much for having me.
Yep.
And
All right. I hope to
wish you-
see you soon.
All right. Thank you, Joyce.
Okay. All right. Thanks, Mary.
Bye-bye.
All right. Well, that's all we have for today. As Mary said, if you are wondering whether you have any life insurance policies, VA benefits, anything that'll help you with navigate your non-medical home health care, reach out to them at Adultcare Assistance Homecare. They cover the majority of the Valley, and they are in Tucson as well. They not only can help you navigate that, they have an awesome team that can perform services for you in your home, but they also are a wealth of information for a wide variety of other resources that you might need as well. And don't forget to visit our website at roseadvocacy.org. Social media links are at the top of the homepage. The newsletter sign up is down at the bottom for the emailed and or the mailed newsletter. And we are having an event coming up on October 24th in Tempe at 100 Mile Brewing Company, a champagne and chocolate tasting. And the chocolate will not be from the United States. It'll be from a lot of other areas, Europe and Asia. So you're going to get to taste some really, really good chocolate and champagne. We'll have dinner and appetizers. So get on our website, find out more information under events, and sign up. There's some sponsorships available. You can buy your tickets, and we look forward to seeing you there on Saturday, October 24th. All right, Brian's going to be here the next few weeks with some fantastic information, and I'll see you back here mid-August. Thank you.
Well, that's all the knowledge for this episode. Tune in every Tuesday at 8 a.m. Pacific Time on K4HD Radio at k4hd.com as Joyce explores a variety of knowledge so you have the power to make scam protection your healthy habit. And until then, feel free to reach out to Joyce and let's talk about scams.